It's a serious question that parents only ask if their child is having some significant problems, either at home or at school, and someone has mentioned attention deficit hyperactivity disorder. In order to receive an official medical diagnosis, your child would need to be assessed and diagnosed by qualified mental health or medical professionals, such as your physician or your pediatrician. At the ADHD Information Library, we have an entire section on what we believe makes up a good assessment and a good diagnostic workup. Take the time to look at that section when you get a chance. Now, we've developed this online screening tool to give you, the parents, more information and some things to think about. But as much as we like our online ADHD test, you simply cannot make a totally accurate diagnosis at home, online, on the internet, with a screening tool. One reason is that we believe that a good evaluation and assessment may take several hours of asking questions, doing testing, asking more questions, and so on. Another reason is that there are several medical or psychological problems that may look a lot like ADHD, but simply are not. Depression, Tourette's syndrome, head injuries, Asperger's syndrome, and bipolar disorder are just a few examples of serious conditions that look a lot like ADHD but aren't. Be sure to look through our section on the differential diagnoses to ADHD to learn more. Now, about our online screening tool, this is an online screening tool that you can use to see if you ought to consider pursuing a professional diagnostic evaluation. You fill out the questionnaire and the computer will score your results for you. But again, it's not an official medical evaluation for ADHD, but it will give you a lot of insight. I put this test together using several of the assessment tools that I developed and used in private practice over the years. The results are weighted toward the different types of ADHD, and I'd encourage you to read through that important section of the ADHD Information Library at newideas.net as well. Not all children or teens with ADHD look the same. Some are inattentive, some are hyperactive, some are impulsive, some are sad or depressed, some are worried or nervous or easily startled. These symptoms result from the different regions of the brain that might be impacted by the ADHD. So here's how this works. When you fill out the screening tool, you'll answer each question from 1 to 5. Be sure that you take the time to think about each answer, and please do your best to answer each question objectively. Sometimes these rating surveys are strongly influenced by either frustration, which may cause you to rate the answers higher than you should, or by fear of getting results that may just tell you what you already know, and so you may answer the questions lower than you should. So my best advice on these kinds of questionnaires is always use your head and not your heart. When you hit finished or submit or whatever the button is at the bottom, if you've skipped an answer, it'll tell you. Just go back, answer that question. If you hit submit again and it just stares at you, hit your F5 button and reload the page, and it should then submit. It should work fine. Your results will also be emailed to you. You'll see 3 categories: low risk or not at risk, and high risk. The at-risk category is the maybe yes, maybe no category. There's a lot of variables you just cannot build into a test like this, such as the age of your child. And I'd expect that younger children would score higher on the test just because they're more immature, but older children and teens should score lower on the test. So a score in the at-risk ranges should be taken more seriously with older children and teens. Also look for any 5s that are answered, even in an at-risk category, because when there's a 5, it means there's something significant going on that needs to be addressed. For categories in the high-risk ranges, look at these sections on the different types of ADHD and see where your child or teen fits best. Then consider the recommended targeted treatment strategies using natural, safe, and effective over-the-counter products and our eating program. You can learn more about these interventions at the ADHD Information Library at newideas.net as well. Thanks, and we really hope that this tool is helpful to you.